Good afternoon, everyone. I'm Councillor David Greenhalgh. I am the leader of the council and I'll be chairing today's cabinet meeting for Bolton Council. I'm joined by my cabinet colleagues, senior council officers and representatives of other parties and my own party who also sit on cabinet. Moving straight away to item 1, declarations of interest. Have we any declarations of interest from members, please? No, thank you very much. Item 2, urgent business, if any. I have none. To item 3, please, and I'll ask Mrs. Rich, please, if we have any apologies for absence.
Thanks, Leader. Yeah, we've got apologies from Councillor Ishmael and Councillor McMulkin is deputising.
Thank you. Move on to item 4, minutes of the last meeting, which are enclosed and have been circulated. Are there any matters arising from those minutes that are not covered in the agenda? No, thank you very much for that. So can I have those taken as a true record? Please indicate if you can. Thank you. Moving on to item 5, which is the corporate plan 2020 to 2021 update, quarter 1 2021 enclosed. I'm moving over to our head of corporate services, our director, Sue. Thank you, Sue.
Thank you, Leader. Good afternoon, councillors. The report in front of you outlines the progress that we have made on our corporate plan priorities at the end of quarter 1, so at the end of June of this year. As we are all well aware, we would have been right in the middle of the efforts around the pandemic at that point. So we have included in section 2 a snapshot of the work that we've been doing in helping residents and businesses throughout this period. And then section 3 just gives an update of our key targets and where we're up to in terms of ratings, and I'm happy to take any questions.
Councillor Howarth.
Thank you very much, Leader. Thank you very much, Leader. The first point I just want to make, and then I've got a question, is that it does detail that the council has become a wellbeing organisation, and that's to congratulate officers for it being said in Greater Manchester and beyond. It was in one of the local government bulletins that throughout this COVID-19 period, Bolton Council has been seen as a very good practitioner in terms of compassion for its workforce. So I thought I wanted to recognise that and say that that is particularly impressive. I'm not sure who else is on the call, but it won't surprise you to know that with you giving me some detail, I think I might be I would be moving off though a question that's not corporate. I'd be probably asking a question that's more general around things like where we're at with community engagement, for example. So that would have to be for a different officer, I think, Sue. But I do have a question that's certainly corporate as well. So I'm happy to come back to that question on community engagement if you want me to. But the other question is, it makes it clear in this corporate plan, and I know we speak to the headline issues on this plan rather than delving into the directorates. It says clearly, establish a more effective, participatory and engaging approach with residents and stakeholders. But I want to hone in on that line about residents. Can you say anything today on what you feel and politicians feel that's going to look like for residents? Thank you.
Thank you, Councillor. So, I mean, firstly, thank you on behalf of the staff, because they have been working incredibly hard, so that is much appreciated. In terms of, I suppose, picking up community engagement, but also engagement with our residents, we've been making quite a lot of progress actually throughout the COVID period in terms of how we utilise the Bolton Fund, how we managed to channel monies through that quite quickly, so that we're using our voluntary sector partners, people in the community, to engage, to help support residents, support businesses, and also have been keeping our elected members very closely involved in the work of the council and receiving excellent support from everybody, as they are our voices in the community. As we move forward, we obviously are looking at a different model in terms of neighbourhood management, and that is something that the Assistant Director with responsibility for that will take forward. The post holder will be taking up the post during October, and then obviously current pandemic allowing, we will be working on a model with support from the Local Government Association to look at what is the best way to integrate with our residents in supporting the Council's objectives. Pass back to you, Leader.
I'm just going to bring in the Chief Executive as well, if I can, just to make a few extra comments. Thank you, Chief Executive.
I don't need the camera. I'm just going to say, actually, Sue's answered the question, so that's it. Thank you, Leader.
Councillor Howarth, do you want to just return to your other question?
Yes, please, Leader. To thank the Chief Executive for saying he will perhaps comment on community engagement. The question I really want to pose is about the fact that we all know unfortunately the COVID infection rate has risen. And so I just want to see if there's anything that anyone would want to say that absolutely we know that much more local test and trace is a part of that. But I'm learning from the other areas all the time, and there's no question that those in Oldham are saying that literally they've been on the streets, and messages have been given are from a couple of cabinet members. So one of them was in Wood Houses, where they were saying in Oldham, where they were saying they were getting a really good reception on the door. Likely they were helping to hand out the self-test kits, but they've been out there in the communities, talking to the communities. Is there anything that I should hear about today that we're learning from those other areas? Thank you.
Thank you, Councillor Howarth. I mean, clearly this is a very worrying time for Bolton. I think we can all appreciate that. The level of the spike has been sudden, it's been unpredicted, and it's been extreme. And you can imagine over the last few days, especially as we've seen the rates continue to increase, there have been considerable meetings with our own officers of public health, our own chief officers, the Public Health England, Secretary of State's Department, Cabinet Office, all looking at different ways. I can absolutely guarantee that the testing kits have been going out over this weekend. We've had teams out on the ground, particularly targeting the 18 to 42-year-old age bracket, which are the particular, not complete, but particular source of concern to us at the moment. So I can absolutely assure you it's a very fluid. We obviously announced some added restrictions. We're doing all we can to keep to a degree or some degree of normality that the residents of this town, we believe, feel they want to hold on to, but discussions are ongoing about what level is needed if the restrictions, if the cases continue to rise, and our level of positivity is of course rising. Our percentage of positive tests is rising. So I'm going to bring in the Director of Public Health, if I can, just to add on to those additional comments. Dr. Lowy.
Thank you. Yeah, I was just going to emphasise the work that's been done over the weekend with officers across the community. We've actually physically handed out over 700 tests this weekend on Saturday and Sunday. What we did was we did an approach that was targeting the younger population, sort of the 18 to 40-year-olds really, through various means, through supermarkets in particular areas and particular places. And the reason for that was to have that engagement so we can actually have a discussion with them as well at the same time, socially distanced in a safe environment, of course, with the full public health prevention social distancing in place, but really around, as I say, case finding for that population group, because obviously this is really key. And I think what we've just got to remember as well is that our spread of the virus is a slightly different pattern to what Oldham's was. So again, some of the approaches that we're taking is so that it is actually appropriate for our residents here in Bolton. And as I say, that's why because our spread is right across the borough. and in that younger population, which is why we wanted to focus in that particular way, and be able to have that conversation with them. And the outreach work through the tests, giving the tests out, will continue through this week and into next as well. So we are doing a very intensive testing strategy in relation to that. Just want to also say we are working with our voluntary sector as well in relation to this. So it is that wider engagement to ensure some of our messages, well, to ensure the messages are key to the public, and working with our networkers within the community as well. And as you know, we've also got some ward member briefing this Thursday afternoon, I think afternoon or sometime on Thursday, with ward members as well, to again support some of the messages throughout within our community. Thank you.
Thank you. Can I bring in Councillor Peel, please?
Thanks, Leader. Just bear with me because I'm trying to juggle the many documents that we have on the screen with the mechanics of using the camera. So I'm just looking at Appendix 1 corporate. So this is the title. This is the corporate dashboard, and so page 14.
We aren't actually on the corporate dashboard yet, Councillor Peel. We're still.
Oh, I do apologise.
I mean, I think we'll be there soon, but are there any? Yeah, Councillor Don. Sorry. Yep.
That's absolutely fine. I've got multiple documents on, and many of them begin with the word corporate, so that's fine. I'll come back. No problem.
It's all right. You might be coming back sooner than you think, but it's all right. But we'll just check if Councillor Donaghy's question is on the corporate plan. Councillor Donaghy.
Thanks, Leader. No, it's a question relating to the COVID situation in the town. A question to yourself, really, after listening to Dr. Lowy. Are you ruling out a total lockdown of Bolton again, or is everything on the table?
I think I'll just switch. I think nobody at this stage, Councillor Donaghy, anybody responsibly can rule out anything. So I think we have to be drawn by the evidence, drawn by the data, which we are, take advice from our experts and our clinicians, and it would be wholly irresponsible of me at this stage to rule anything in or rule anything out. We have to respond as we see the data extrapolate.
Thanks very much, Leader. Thank you.
I think if there's no more questions, we will then move on to item 6, which is the corporate dashboard Q1. And if I can bring in Sue Johnson again, please.
Yeah. Thank you, Leader. So again, this report that's been circulated is a snapshot of the corporate performance KPIs through which we measure performance of the council in each of the directorates. Again, it goes into a little bit more detail around the response that each directorate has been making to the COVID pandemic in supporting our residents and businesses. And I'm very happy to take any questions.
Thank you, Sue. Well, we know we have a question from Councillor Peel, so I'll bring him in directly.
Thanks. I'll try again. So I'm just looking at page 12. Where we've got we're talking about corporate income, and I know that the narrative is slightly different because we've got this headline indicator corporate income for 2021, and then on the following page, on page 13, it's showing Q1 2021. So obviously Q1 2021, as expected, is showing a drop in council tax collection, and it's showing a drop in business rates collection. So I'm trying to actually apply those two facts with the headline indicator corporate income, where it appears to be showing that we're not only on target but slightly over target. We've given ourselves a green rag rating for that. And then on the next page, as we go down to page 14, corporate savings program. Again, this doesn't appear to be. It's telling us it's for 1921, which I'm not sure whether that's a typo or it's supposed to be another broader period of time. But I suppose my question is whether these two on paper positive reports, both corporate savings program and corporate income program, how realistic are these now as indicators? Because we know from other meetings, other briefings, and other facts that are out there in the public domain that we clearly are not in the position that these reports would indicate that we are. We're certainly not in a healthy position, and obviously the alarm bells are contained on page 13, where we're looking at the loss of income. Now that's just council tax and business rates, as far as I can see. We're not even talking about loss of income from other sources, airports, etc. So it's a bit of a kind of highbrow question, I suppose, really for the Borough Treasurer. But can she comment then on our headline indicator corporate income and on our headline indicator corporate savings program? Thanks.
Sue?
Yeah. Okay, thanks, Councillor Peel. So in terms of the income, of course, this report just relates to the position as we were projecting at the end of June. And since then, we are getting much more information in terms of the rates of council tax and business rates and other sources of income that have started to suffer as the pandemic continues, as the financial year continues. So when we come back with an update of this report towards the end of the calendar year, then yes, the position is likely to have altered. So we will provide a further update. In terms of the savings, they are ultimately the savings that we need to get out in the second year of our 2-year strategy. And that is holding strong. We anticipate that we will be able to get those savings out by the end of this municipal year. A number of reports are currently making their way through our democratic processes in doing that. But I think you're right in flagging up that the income strain on the council will be something we need to keep a very close eye on, and we will be able to provide a further update in this format when we provide the update at the end of probably around December. Pass back to you, Leader.
I think Councillor Hayes, Councillor Peel just wants to come back with a quick question, catch up.
Thanks. Sorry, I just need to clarify what the Borough Treasurer just said. Is the Borough Treasurer saying that we are on track to achieve all of the planned budget savings for this current financial year?
Yes, that's correct, Councillor Peel. We currently expect to have those savings, the remaining savings from our 2-year strategy, achieved by the end of this municipal year.
And so obviously it's a 2-year strategy. So are you talking in terms of just this current financial year, or the 2-year budget that we've got?
So that the current budget that's in place was a 2-year strategy. So last financial year and the current year, we achieved a lot of our savings in last year, around about 13 million, 14 million. The remainder of the 23.5 are to be achieved in this current financial year.
Okay, thank you very much. Councillor Hayes.
Yes, thank you very much, Leader. My question is on page 38, the employment rate. Now, we're used to seeing the North West and Bolton doing less well than England as a whole. what's very worrying to me about these figures is that Greater Manchester seems to be holding its own at 72.6, 72.7% employment, whereas Bolton seemed almost to have fallen off a cliff. It's really dropped, and it's very alarming. Can we have some comments on the reasons for that, please?
I think it may be suitable for Jerry to comment on that one, Leader.
Jerry, Director of Place, Mr. Brough.
Yep. Right, sorry, I was waiting for it to go live. Yeah, the levels of unemployment have not exactly fallen off a cliff, but they have reduced substantially. If you look at the graph, you have to look at the axis to see that it's not exactly a huge drop, but it is declining compared to Manchester and to the northwest as a whole. I don't have a specific reason for that at this moment in time. I can't put it down to any single closure or any single reason why less employment within Bolton, I'm afraid. I would need to get back to you on that and look behind the headline figures to see what's making up these numbers.
Yeah, thank you, Jerry. I mean, I'm not. Politicians do always exaggerate a little bit, as you'll understand, but it is a concerning drop, particularly as the rest of Greater Manchester is staying much there. And I very much appreciate a bit more background when you've got the chance to have it. Thank you.
Okay.
Thank you. Councillor Zaman.
Thanks, Leader. Councillor Hayes has asked the question I was going to ask, but I would just add, if this employment rate keeps declining, would we start looking at some kind of intervention, and what interventions would we look at? It may be too early to say. Due to the volatile nature of economy right now, due to COVID-19, I can understand employment rate fluctuating, but if it keeps going down, then we need to start thinking about interventions. So when, Jerry, when you're looking into the reasons behind this, it may be worth bearing that in mind.
Thank you, Councillor. I can postulate a reason for it, and the one that I think is most likely is that Bolton doesn't have the same amount of influx of new, younger people coming into the job market that Manchester does, for example. So this is the number of residents in employment. Remember, it's not actually the employment level. People will be leaving the job market for all sorts of reasons, and we generally have an ageing population in Bolton, which would indicate that we have a high level of people leaving the job market through early retirement, or through illness and ill health. And these are not generally compensated for by an influx of younger people compared to the rest of Manchester. So I think that's what keeps the Manchester figures up compared to our figures. But as I say, I need to look at that in a bit more detail to see why people are leaving the job market. That's the first thing to look at, and then secondly, why these leavers are not being compensated by new people coming into the job market. But I suspect it is due to the lack of incomers in younger age groups, and also we do have a leakage from the universities and students who would leave the town and go and get work elsewhere. And part of our effort over recent years has been to try and keep these people in the town and offer them opportunities for career apprenticeships and career opportunities in the town centre. We will continue to do that, but I'll get back to you with a bit more detail on the numbers as to why people are leaving the job market at the rate that would appear to be the case on the graph.
Thank you.
Thank you, Jerry. Councillor Howarth.
Thank you, Leader. I'm aware that the government have given some money to the economy to assist with the employment of young people. Some of that may be, though, around training. I'm not sure how it doesn't guarantee necessarily employers offering up jobs. Of course, we yet need to see all of the detail on that. But I'm going to just ask around the whole business of what we call NEET, people who are not young people who are not in employment, education or training, because of course the council in its work scores itself presently red, and I think, you know, the last time we saw this this dashboard, it's been red, and it's an area for work. And so I want to, I think there's an understanding at the council that that there's an approach of two key things on that. One is the more immediate, the short to medium term, which I've not really spoken to before. What I've spoken to before is the other second part of the approach, which I'm persuaded on, is what you call the upstream issues, which will certainly be in children's services and families and so on. But do we feel we've got something called a NEET reduction strategy at the council? And do we feel that we're learning from council areas who may describe that they've done well on NEETs, that they have been able to not come out of things like red score areas? Is there anything any of the officers or politicians would want to say about that? Thank you.
I'll just come in first on that if I can. I think you raise a really huge point, Councillor Howarth, and one that is a challenge for us and remains a challenge for us. Let's be honest about it. But I am going to ask if the Chief Executive will share with all colleagues the presentation that Jenny Applegate gave at the from the DWP at the Active Connected Prosperous Board, which was a hugely informative piece of work around the amount of intervention work they're doing, particularly around young people and particularly around this area, and the additional government support that is being put and is being put currently during this pandemic into the system. So I'll use that as a bit of a backdrop before I bring Bernie in just to comment, but that I think will be useful for all colleagues from all parties to see and be, if they are not already aware of, certainly be kept up to speed on. So if I can give that as an action point to the Chief Executive to make sure that happens, I think that would be incredibly helpful. Bernie, can I bring you in please on this? You're on mute, Bernie.
Sorry. Thank you, Leader, and Councillor Howarth. I'm not sure we have something that we call specifically a NEET reduction strategy, but it's something that tests us and has our focus. We are fortunate in Bolton that we continue to retain a connection service, and that does have a early planning strategy for our 14+ young children to try and support them through routes kind of through either further higher education and routes to employment. I think one of the areas that people might not always acknowledge as being a challenge for us is a number of our NEET cohorts are unaccompanied asylum seeker children who we have supported through sometimes additional English as a second language and additional skills, but then also our population of young people who are involved with the youth offending team. And some of those children, despite the best efforts of Barry, our education worker in the yacht, are challenged because of their history and the risk assessments that are associated with them, which means that we consistently have a cohort of young people who every year we struggle to find any form of employment to offer for. We have seen the reduction of firms like Silcox in the town, which means that previously that the employment offers that were available to young people have been taken away, and we do struggle to find placements for routes for particularly for vocational training and kind of more appropriate apprenticeship schemes for young people. It is an area that we work incredibly hard on, but nationally it is an area that presents real challenge.
Thank you, Bernie. There are no further questions indicated. So with that, we'll move on to item 7 on the agenda, which is the GM Clean Air Plan consultation proposals, which are enclosed. And if I can ask Councillor Warren, please, to present. Thank you.
Thank you, Leader. So this is to approve the report to enable the start of the statutory public consultation. And that's all nice and short and sweet. Thank you.
Thank you, Adele. Have we any questions on this, please? I'll just give the due time for yes. Oh, they're flooding in now. Councillor Howarth.
Happy for the group leader to go first, please.
Oh,
Councillor
right,
Green.
yes. Yeah, Councillor Peel.
And there's a conspiracy of people taking me by surprise here. I didn't think Adele was going to finish so quickly, and then I thought Sue was going to speak. But anyway, my question, it is quite possibly contained within the narrative of the several reports that we've got before us, but I'm interested in the separate piece of work that's going on at a national level, which is the decarbonising agenda, and there's been talk over since we first started discussing the clean air zones. There's been talk about the issue of doing nothing, and so if GM or indeed any other city region did nothing, at what point would the decarbonising agenda actually take over in terms of timescales, and we would become compliant in terms of the particulates in the atmosphere? It may be that Councillor Warren can't answer that. There may be an officer needs to answer it. But the last information I had on this was it was literally a matter of, a few years before other legislation about fading out certain types of cars, etc., and other things that are on the agenda would actually achieve what clean air zones attempt to achieve, but just a few years later, because the government line seems to be throughout that the whole point of the clean air zones is to do it as quick as possible. So in other words, it's not worth letting other agendas actually achieve the same results by waiting a few years. So I suppose I'm after a specific date or timeline as to when the decarbonising agenda would achieve what clean air zones are attempting to achieve.
Adele, do you want to come back on that? Yeah.
Thank you. Obviously, in terms of kind of the exceedances and the legislation, we've been exceeding for a while the limits. And part of the kind of the directive really is to achieve it as quickly as possible. So the hope in the putting off in the hope that eventually we'll hit it sooner rather than later just isn't an option. And especially it's part of the client, the challenge that Client Earth has given as well, that it needs to be achieved as quickly as possible. And that's the reason for the CAS and the reason from the direction as well. I hope I've answered that. Yeah, no. No, okay. Thank you, Councillor Field.
I think probably the certainly some of the anecdotal dates that I've been given is that within a further 2-year period, levels would be reached anyway. I think that's probably what Councillor Peel is kind of getting at. This, of course, is a document which leads to further consultation. It actually it is consulting with still a lot more information needed within the document, and some very crucial information within the document regarding the help for particular sectors of the community. And those sectors primarily have had, large coverage, that of the the private hire and taxi trade and white van man especially. And of course, there is also still the information to come in regarding the social hardship fund. And I think a lot of conclusions will be drawn, I think, not just here amongst politicians here, but certainly at GM level across all parties at GM when that further information finally arrives. So the government is consulting first to draw the conclusions about the level of support that is given. So it's very important that we as a council present the case for those sectors very strongly and lobby very strongly to ensure that those sectors get the support that they quite rightly should have, and that they not be left at a disadvantage. So this, I say, is a consultation, the starting of a consultation process which is going to all GM authorities, but we have to ensure that we robustly take part in that consultation and give back our own feedback to make sure that the help is given. So we have got a few more questions. Councillor Howarth, are you ready to come in now?
Yes. Thank you, Leader. I do want to ask secondly about private hire, but the first thing I want to ask is that I came across the fact that at least a couple of councils in Greater Manchester have formally written to ministers, and I want to find out whether we have formally written to ministers on one of the aspects of air pollution. That there, of course, their letters were, it sounds like they were stern letters. So pertaining to Bolton, we know that we've got highest levels around Harper Green, Farnworth and Kersley. That stands out. And of course, what those stern letters have been about is what the government is doing about motorways. So I thought I am going to ask next time this comes on a meeting, have we written formal letters about, if you like, perhaps our dissatisfaction or what our position is on what government is considering about the accountability pertaining to clean air on motorways? Should I come back in a minute and just ask about private hire as well, Leader?
I can certainly answer that for you.
Yeah.
Straight away, and when that's dealt with. Yes is the answer, and we've actually got a meetings planned with the Secretary. We've been in communication with the office of Rebecca Powell, and we've had communication, and we have been promised for the last certainly a few weeks. Obviously there's been a lot of other things going on with COVID, but we have been promised that this month we will have a face-to-face or a screen-to-screen meeting with the Minister and her civil servants to voice our concerns regarding the motorway. I think you raise a very valid point. Certainly the A666, you look in other areas, we are having discussions, very, very current discussions about our dissatisfaction that the A666 is perhaps, or should it be perhaps, a Highways England option in many areas, and there are examples in other parts of the Northwest where such roads, particularly if you think the A666, and I don't mean obviously where it becomes Blackburn Road and those areas, but the A666 from the junction of Turton Street and Blackburn Road down as it becomes a formal dual carriageway which leads onto the motorway. Should it be redesignated? Should that be something which is taken into consideration? Certainly something that Tameside is progressing with one of their roads at the moment. So I think you raise some valid points, and they are current items of discussion with the present departments. So yeah.
So I'm going to move on. Thank you. So I want to ask about Hackney and private hire. So there are dates set for Hackney and private hire to be certain age vehicles, and rules around carbon emission and so on. So what's the thought at the moment? How will upstream we not want to be granting licenses for certain vehicles where we know they would not meet a criteria by a forthcoming date? What's the thought? Is it that we wouldn't grant, or will the emphasis be more in the applicant, or would we grant and at least issue a sort of notice of helpful warning to the licence holder, because it may be that it will be their choice what they want to apply for, of the impending date and options as things change. I hope that makes sense. So there's a timeline in all of this where people will carry on making applications within the licensing function. So I'm trying to get a sense whether any work has been done where how we would grant licenses in that period of time, where if they got a grant 1 week, in literally a number of weeks going forward, they might not be able to use their license. I hope I set that out as clearly as I could.
Personally, I hope that we would work with the sector and that we would show some flexibility and be able to offer that. I'm going to bring in Councillor Warren to see if she has any detail on the process. I know it crosses over really into Councillor Fairclough's, and then Jerry might want to come in as well here. But I would hope that we would practice a degree of flexibility, bearing in mind the changes that everyone would be going through. So I'll bring in Adele first and then see if Jerry wants to add. Adele, do you want to comment on that?
Thanks, Leader. Yeah, I was just going to say, obviously, this does tie in with the minimum standards work that's currently continuing at the moment, and they will be consulted on at the same time because they are so closely linked. And obviously, one of the reasons to link it with clean air as well was to be able to try and give the trade support in terms of the incentives. Now, obviously, at the moment, we're still waiting to hear back regarding some of that, but a lot of that will be based on the consultation. There is a lot of work in GM that's going on with the taxi trade and the hackney trade as well, and lots of consultations with all the groups that will be affected, just to support them as much as possible as well. Thank you.
Thank you. I'm going to bring in Councillor Fairclough before I finally bring in the Director of Place if I can. So Councillor Fairclough. You're on mute, Councillor Fairclough.
Yeah, there's not an awful lot I can add to what Adele's said. There is a lot of consultation going on. In fact, we meet again with the taxi trade on Thursday. There is a lot of money at the moment being suggested that will be used to help with the private hires and taxis to bring them up to standard. It may not be enough, and I think we will be looking to try to get more as things move on. But really, it's all down to the consultation, which is starting in earnest. Bolton have done really well. We've had quite a lot of green on our grids to show that we've been very proactive. But it's really just beginning, I think. So I can probably answer your questions better in the next couple of weeks.
Thank you. Can I bring in Jerry, please? You're on mute, Jerry.
Oh, apologies, Leader. Just to add to what's been said, the minimum standards that's being consulted on at the minute part of the consultation will include the time frame over which these will be introduced, and I'm pretty sure that it's not going to be something that's going to be introduced overnight. The trade will be given substantial notice of these impending changes, and the intention is to work with the trade to make sure that these are introduced, in as straightforward a way and as a minimum disruption as possible, and that will be subject to consultation also.
Thank you. Councillor Donaghy.
Thanks, Leader. Going back to the hackney and private hire trade, included in the bundle is a very comprehensive letter from their association explaining the difficulties they've gone through during COVID and continue to experience. I mean, I think your point's very relevant, David, and where you said that you wanted support, and we've gone through the whole arguments of scrappage schemes and all the rest of it. What I'm wondering is, do you see a point where possibly the changes could be paused slightly, albeit we have a timetable to honour, but because of the difficult situation some of those drivers now find themselves in, that there might be a pause? Or would you be saying to the government, look, we're going to need additional support for these people because of all the groups who have suffered under COVID, they seem to have been hit particularly hard?
So I think my view on this is until, as I said earlier, Martin, until we actually know the degree of support that is coming in from government, we cannot come to a conclusion of whether we support the overall measures or not. And I say that as someone that is really keen that we lobby as hard as we can to make sure we don't get to a point where we are one of a dissatisfied. But the reality is that this has to come finally before every council within Greater Manchester. If one individual council votes it down, then that council would have to go it alone with any legal, or there is a choice that they would have to go it alone with all the legal obligations. So by voting it down, we don't dismiss the legal obligations that we have. So doing nothing is not an option because we have a legal directive on us to do something. However, I do think that we shouldn't rule out, as you say, possibly a pause happening if it looks like, because the reality is if we feel across GM that not enough money is coming in, then for these sectors, and including that as well, the self-employed sector, which I think is a hugely important sector as well. I know taxi drivers and private hires are self-employed, but I include, you know, your plumbers, your plasterers who go about on a daily basis in their vans delivering self-employed and doing, you know, great work. I think if the help and support does not come in for those, we face a really crucial decision. I'm not pushing this, I'm not kicking the ball into the long grass. This is genuinely just saying that until we get to know this final amount that's before us, it's very difficult to make an overall judgment. And yeah, I don't know if Adele wants to come in there. Adele, do you want to come in with anything?
Yeah, I was just going to say that there has been a specialist task force in TFGM that's been set up to look specifically at the implications of COVID. Now, obviously, one of the big concerns for myself is that businesses may choose to just pay the fee and then not upgrade their vehicle, which means that our air quality doesn't improve. So the measures that are put in place need to be effective, because it's pointless going through all this and then it not actually impacting on our air quality. Now, obviously, at this stage, this is just for consultation. We're not agreeing to do anything, and the different policies need to be worked through as well. And especially with the impacts of COVID, it does need to be looked at more, and we are doing that. Thank you.
Thanks, David. Thanks, Adele.
Thank you. Councillor Peel.
Thanks, David. There's a couple of things I want to make come back on and make a couple more points, really, without hopefully not becoming a situation of deja vu, because I don't think any of our positions have changed on this over the last couple of years since we started discussing it. In terms of Highways England, in fairness to Councillor Warren, I think there's reference in that report to Councillor Warren writing to the Minister on this particular issue. We're all absolutely agreed that there is no reason whatsoever for the government to not include Highways England in this. If they were really serious about the measures, then they would have done it. And I wonder what Client Earth would do about that. At least we've now got from the points of the government completely ignoring what GM have been saying to them, now responding to GM and saying, well, we'll look into it. At least that's a bit of an improvement. I'm not sure about the issue of redesignating the A666, you know, because the charging zone isn't based on you crossing a particular point in the borough. It's you're just charged for having that vehicle in the borough anywhere in GM. So whether St Peter's Way is outside of the scheme or not, it makes no difference. People will perhaps use that instead of Manchester Road under the pretext that they won't be charged, but of course that's misunderstanding. It's not like a toll. The other point I wanted to make was, and thank you, David, for confirming what I thought. I was pretty sure that we'd had evidence in all previous discussions that a doing nothing option would simply delay compliance by a matter of a few years. And people have always asked themselves this question: what the point of all this time and trouble, etc., for the sake of a few years? Now, if you take the issue of clean air and the health impacts very, very seriously, you will disagree with that point. You'll say, no, a few years does make a difference. It can save lives. But there's certainly other parts of Britain, and I think Leeds is the one that springs to mind, that's now arguing that the emissions have so changed since COVID, since road traffic has decreased, that we're actually almost compliant, or if not compliant, almost compliant. And then that will depend on what that long-term road traffic patterns are in the future. But you can easily see, can't you, following Councillor Donaghy's question, a delay in implementation, knocking it forward another 12 months, and then the argument being just about, well, it's a matter of just 12 months before we achieve compliance, and the whole thing just becomes really silly. I want to agree with what Councillor Warren said in terms of her concerns about people's response to it. I mean, we don't know, but my personal opinion is we're going to see some self-employed people, like taxi drivers, and some white van drivers who are kind of close to the knuckle anyway, going under, not being able to financially survive, whilst we get other self-employed people, the white van type vehicles and HGVs and buses, where the costs will just be passed on to the customer because they will be in the situation where they'll be able to do that. So they have a choice of one or two. They can either take advantage of various grants, but then they have to put in quite a bit of money themselves to upgrade the vehicle, or they take that financial hit by either going under or passing the cost on. It is not going to be 100% of either one or the other. We're going to get a mix of that, and therefore we're going to get possibly not achieving the objectives that it's supposed to achieve. I have to again say, without repeating things that I've said before, this is not a national government response to the UK's obligations on clean air. This is the national government cherry picking what it perceives as the worst polluted areas in Britain and passing it on to them. And each year they add on more authorities to this list, and this is not in any way, shape or form a national clean air strategy. And I think that's the biggest shame, that this should have been picked up. I think we've not been compliant since 2010, so this should have been picked up a while ago, and there should have been a national response which included a national infrastructure investment scheme, and especially charging points, which appears to be continually curtailed. I don't, and I appreciate the leader saying, well, you know, all this is a consultation at the moment, and yes, it is technically, but if you look at, you know, just look at what the recommendations part of the reports, and it says this report is not seeking a decision on whether to introduce a scheme as that has already been mandated by the Secretary of State. And so you get to the point, don't you, where once the consultation's done and whatever decision this council makes or other councils, that line's still going to be factual. It doesn't really matter what you decide to do, what you do. It's been mandated. You will do it. And I think therein lies the problem. It isn't a political point I'm making, because as far as I'm aware, we're all pretty much agreed on this point. It is, I think it's a massive missed opportunity for the government to have achieved something really substantial, and we end up with this half-baked, very cack-handed way of tackling a major health and climate problem. And so again, I will reserve future comments for when the next report comes back to us. Thanks.
Yeah, thanks, Nick. And and the last point you raised there is key, that we are consulting here on the help that can be given and the support that can be given, because you're absolutely right. The directive came as a legal directive from the government in March of the proposals. So what we're consulting on, and what I think will be a great challenge for us, for the public, is they will think we're consulting on something a little different than what we are. In actual fact, what we're consulting on is the degree of help and the amount of help that is needed for those that maybe find themselves involved. I'll just ask Adele if she wants to come back with anything further.
Thanks, Leader. Yeah, I just wanted to make a couple of comments really regarding kind of like the Highways England roads, and especially with our roads that we do have our exceedances on, that they're the most travelled roads. That keeps the pollution out of our residential areas. And one kind of flaw really with the Clean Air Plan is that it doesn't look at the impacts of where the road are and where the residential areas are. It just looks at exceedances. In terms of, obviously, during COVID, we did have a reduction in cars on the road, but unfortunately we still had exceedances. So the directive is quite clear, legal challenge was quite clear, that we have to reach compliance as soon as possible. So unfortunately, if we don't do anything, we could end up with a legal challenge, or we have to do our own plan as well. And you've got to think as well, Councillor Peel, how long this has been in the making and how much modelling's been done, and the whole kind of journey that this has taken as well. So it isn't without its flaws. There are flaws in there, but I think obviously at the moment it is just the consultation, and I'm sure we'll have many difficult debates going forward once the consultation comes back. The plan for the consultation going live, I believe, is the 8th of October, which is also Clean Air Day. Okay, thank you.
Thank you, Adele. So the recommendations are listed on the front page of the report. Can I ask, just for the point of clarity, can I just ask for Cabinet members to just unmute, no bother putting your cameras on, and just confirm, please, you're in support of the recommendations of the report, please.
Aye, in favour, David.
In favour.
Yeah.
Thank you for that. So we move on to item 8, which is the Public Health Annual Report 2019-20 and the JSNA. Helen, please. Helen Lowy, Dr. Lowy.
Thank you. I'm really pleased to present to you my first Public Health Annual Report for Bolton, and which really looks at the health of the people of Bolton. Yes, there is actually photographic evidence of me trying to waltz. It's not in the report, but it is there for you. I'm not going to come on to the JSNA in a minute, so those slides I'll come on to in a minute, but just to go through the actual report first of all, the Public Health Annual Report. As I say, you've got it in front of you. And really what this is saying is that the core purpose of the Director of Public Health is to be that independent advocate for the health of the population, as well as system leadership for improvement and protection. And that independence is expressed through the DPH annual report, and is an important vehicle for providing advice and recommendations on population health, to both professionals and to the public, and it is a statutory duty, and the one that's presented here is the one for 2019-20. Obviously it would have been presented a little bit earlier, but due to COVID it's been slightly delayed, but nonetheless it is available here. Just with that in mind, so the information that's contained within this report is actually from, as I say, from 1920, so we've got the information there. And as I say, it really does give that overview of Bolton's health of our population, and looking about to get that better understanding and understanding the health and well-being of our residents. And it also is really aligning to the Bolton's vision as well, and coming together of the Health and Wellbeing Board to launch the Active and Connected and Prosperous Board in July 2020. And really about ensuring that we have a clear and shared understanding of the challenges that we face and recognise the strengths and opportunities that we have here. Just reflecting on my first year in Bolton, we have created a public health directorate within Bolton Council, that we work right across all of the directorates within the council, but also wider, and we've been using the Healthy Weights Declaration just as an example to embed our approaches into our council's priorities. We've worked with a team to develop our public health strategic business plan, so we're refocusing our efforts around the Bolton's vision, as I say, for 2030, and really focus on the inequalities agenda, and sought agreement for the Health and Wellbeing Board responsibilities, as I say, with that longer focus on health and wellbeing, providing the leadership, and as mentioned, the creating the Active, Connected and Prosperous Board, and also produce the JSNO, which we'll come on to in a minute. I'm not going to go through it in detail, it's there for you, it's published, it'll be freely available on the internet as well. We just really wanted to recognise, as I say, the work that's gone through, and also it does outline both our challenges but also our opportunities, and really going forward to take that assets-based approach within this. What I just want to also just draw your attention to in relation to the report itself is at the end of the report for the next steps, and obviously the impact of COVID will be impacted across Bolton and beyond, but despite that, people have come together in Bolton, they supported each other to stay safe and well, and it does show the strength that we have here within Bolton, within our communities and within our neighbourhoods. For our next 12 months for public health, we'll be launching our JSNA, and as I say, that's the next part of this agenda item, and this will to support the strategic decisions to be intelligence-led. Again, the other second recommendation or next steps is to ensure inequalities remain embedded across our vision and our Active, Connected and Prosperous Board, and also to undertake an adverse childhood experience prevalence study to look at the deeper understanding and picture across Bolton, and as well as driving the intelligence-led approach, continue to lead Bolton's multi-agency intelligence hub, so again that we support the strategic goals and our strategic vision. Continue to lay the groundwork for the Healthy Weight Declaration, again taking a whole systems approach for this through policy, engagement and advocacy, as well as review and shape our pharmaceutical needs assessment. Just wanted to quickly say that the P&A, the pharmaceutical needs assessment, was due in 2021, but because of COVID that has now been put back to 2022, but we will be starting our the full process for that within this financial year. So before I go on to the JSNA, I'm just going to pause there to see if there's any questions from anybody in relation to the Public Health Annual Report.
Just before I bring in Councillor Howarth, I just want to thank Helen and the team. It's a fantastic piece of work, this, and this, along with the JSNA, is going to put us in great stead. It fully identifies, give us evidence base to a lot of the issues and challenges we face in the town, and a lot of the evidence we can use in terms of applying for additional funding, and to support other organisations that help us and target interventions in these areas as well, particularly through the Bolton Fund. So a huge thank you for producing this piece of work, which is really, I believe, a real breakthrough, and will provide a cornerstone moving forward. So, Councillor Howarth, question please.
Thank you, Leader. Yes, I would echo what you said about the report, because my question is going to be on the public health report, and say that, you know, as I read it, I thought, I hope a lot of the public get the chance to have a look at the detail of this, because you really get a good sense of, as you say, both the strengths and challenges of the whole borough. And I would encourage the press and everybody else to get this report shared for everybody to have a look at. And one of the items in it is infant mortality rate. And it reminded me that this is nearly always small numbers. And it's hard, I feel, that people don't realise the significant differences of something like a 0.5% or a 1%, you know, when the public or others look at those statistics on infant mortality rate. And the report notes the borough's significant infant mortality rate, and this is of course part of the statistics on getting the best start in life you can. Very important days and years. So I just want to ask whether you feel that there's a good plan of action to drive the rate down, and what would that involve around what we might call harder to reach mothers, please, Director? Thank you, Leader.
Thank you for that, Councillor Howarth. Absolutely. I mean, infant mortality is an absolute priority for us here in Bolton, and it's working with our partners right across. What we do know is various initiatives and programmes of work to reduce infant mortality. We know that one of the best outcomes for both mother and child is breastfeeding. And for me, it's not just focusing on just the child and the mother, but it's also about the social acceptance of breastfeeding within public places, and how we can support mothers to feel empowered to be able to breastfeed within our society, wherever that may be. It's also around, again, supporting mothers to improve the life chances for the children. We have, just to also say, we have a CDOP, a Child Death Overview Panel, and this looks at all deaths across Bolton and really scrutinises and understands to say, are there any prevention messages that we can have in here to prevent child mortality. For infant mortality, again, in addition to breastfeeding, it's also our work that we're doing, and we're doing a lot of work still within the communities to stop smoking for people who are pregnant, to support mothers and fathers to stop smoking during pregnancy and beyond pregnancy. So as I say, there's an awful lot of work that is going on, and we can never be, again, complacent about it. It's about supporting across and targeting when need be, because again we do know from the evidence that deprivation does obviously have sometimes poorer outcomes, and again because of some of the lifestyle challenges that are faced. And again, that's where we're working and doing some of our concentrated work, and especially in relation, as I say, to stop smoking and helping with the obesity. But again, just want to come back to, that's why healthy weight declaration was actually chosen as one of the examples that's right across the whole system, so that we can support people and enable healthy choices to be an easier choice to make. Thank you.
Yes, thank you.
Councillor Peel.
Thank you. Yeah, it's I think it's an absolutely brilliant piece of work. I've seen documents like this in the past, not so recent, but I think this is one of the the best I've seen in terms of just there's such a huge wealth of data and information in there, and it does enable you to draw quite a few conclusions as well and see patterns in things that I must admit I haven't had time to digest it all, but I certainly will try and have a go. You can see where the massive amount of work that's been done over many years on reducing teenage pregnancy has actually worked. You know, the figures do pan out there, and I think that is something that public health really needs to be proud of. On the flip side, we see a trend in the rise in violent crime since 2015. Another thing I would want to comment on is reception rates or obesity for young children. Bolton remains relatively under the national average. I would hope that part of that is the fact all schools, state schools, provide healthy, nutritious meals, but the fact that Bolton school meals is one of the most affordable in the country, I would hope has some bearing on our better reception rate or obesity, because of course when kids get to secondary school where we're not as good, those types of messages tend to go off a bit, which probably indicates we need to do more work with secondary school children as well. One thing I would want to see if that's possible next time is the indices of deprivation. There's no there's no comparisons, there's no trends shown there, and that would be quite interesting. And to know why certain areas have remained the same and what the impact of overseas emigration has to particular wards in Bolton on indices of deprivation. We know that to be the case, but as ever, you need the evidence. And a final comment is the table at 4.2, the adjusted odds ratio. I hope I'm reading it correctly. I hope I'm reading this data correctly, but it is quite, it is quite shocking to see something in black and white that we've been told for years about the life chances of children who have experienced what we call adverse childhood experiences, in layman's terms, being mistreated and being abused whilst the children. And we see these shocking figures. They're far more likely to be involved in violence, criminalisation, far more likely to be incarcerated, far more likely to be on heroin and crack use for a lifetime. And it's like anything, isn't it? You need the data, you need the raw data, you need to evidence something in order to drive an argument. And the argument we need to continually drive on this is we can prove that early intervention can actually save a child from going right downhill once they've reached adulthood. And so to me, this is just the first step. This type of report, it gives us that evidence and those building blocks that we need as a responsible local authority in partnership with other agencies to actually then start devising strategies and plans to change some of these shocking figures that we see. Thank you to you and your team for putting this together. I think it's really, really useful.
Councillor McMulkin.
Thank you for bringing me in. I was looking at the piece on housing and homelessness within the report, and I wanted to ask a question in terms of, as the authority, us as an authority, had a look at, as we're all aware, there was a hold put on court actions for evictions that ends on the 20th of this month. Have we done any sort of assessment as to what impact that will bring about in Bolton in terms of court actions and possible evictions and increasing homelessness, and also assessed the possible increase in evictions that are directly related to the COVID-19 and the impacts of that? That was the question. It's just something that as it ends on the 20th of this month. It's a possible problem that's coming down the line. Thank you.
Thanks for that. I haven't nothing specific at the moment, but what I will do is after this meeting, we'll pick up with Jerry as the director of place, because what as well, just to say that obviously within this report, this is the start of the journey with all of our information, and that start of that intelligence led. So Jerry and team might have done some particular work on that, but I will pick it up and then we can feed in as appropriate. So thank you very much for that.
There certainly is some work going on at GM level regarding that, and I know a letter has gone off to the minister asking about just reflecting on the implications regarding that date. I'm not sure if any other officer wants to come in regarding that, but I know some work is being done around that at this stage, so I'm not sure. I'm not seeing any indication. We'll certainly get some information back to you, Councillor McMulkin, on that, but I do know there's some GM work, piece of work being done around the implications of that and preparations in terms of what we think some of the outcomes may be. And I know there's been conversations relating to this issue on working with the Justice Department as well, in the way in which some of these evictions are dealt with, so that our own housing services within Bolton are given a heads up of those families, because now, with not having our own magistrates court, we used to have a way into and an indication of the potential problems within certain families and certain and maybe possible homelessness issues. Since those have now moved to Manchester, there has been less communication and therefore less chance to be proactive as opposed to reactive. And I know the housing officers are working, trying to get those connections back together with the justice system so that they can be made aware of issues that may be on the horizon. But I'll make sure that you have got a full update on what work we're doing as a council to look at ways to mitigate this. So if I can now move on to Helen for you for the JSNA, is that okay?
Yep, thank you. So Bolton's Joint Strategic Needs Assessment, I just also want to give real credit to Lynn Donkin, Assistant Director Consultant in Public Health here in Bolton, who's really been instrumental, both leading the team for this from an intelligence point of view and also pulling the JSNA together. Can I have next slide, please? So just to quickly go through a few slides, just to outline what's the process, why it's important to have a JSNA process, what is a Joint Strategic Needs Assessment, what does it deliver, how we share the story of the health and wellbeing needs in Bolton, the governance arrangements, introducing our new website, as well as just quickly outlining the pharmaceutical needs assessment. So next slide, please. So why do we need a JSNA? Well, we know that our vision is very ambitious here in Bolton, and delivery of that requires access to and an effective use of intelligence, where it's drawn from a range of service sources, and again providing that robust evidence for strategies and for action. JSNA is actually a statutory responsibility. It's a duty, responsibility of our local authority and the CCG and the clinical commissioning group, and that's discharged by the Health and Wellbeing Board. As a statutory duty as well, it also facilitates the delivery of a pharmaceutical needs assessment. The pharmaceutical needs assessment is a statutory duty, but majority of the time the people who do the JSNA and the pharmaceutical needs assessment are the same people, and it also comes together under the Health and Wellbeing Board. So for us here in Bolton, now comes under the Active and Connected and Prosperous Board. Next slide, please. So JSNA is essentially a set of local systems and processes that produces a summary of the health and wellbeing needs that's met by local authority, the CCG or NHS England. It's recognised and shared by all partners in our local communities, and we can actually do more detailed assessments, such as going into ward level data, specific topics. So we might want to do a more detailed analysis on a particular topic or a particular population group, or look at some of those wider issues, as I say, such as employment, transport or housing. Next slide, please. Really what we're trying to deliver here is having that shared understanding of our health and wellbeing needs, our inequalities and our determinants of health for Bolton. It's having access to data, intelligence and insight on population health and wellbeing, as well as the wider determinants of health. And again, it's supporting that culture of insight and intelligence-led working. It's also looking at the assets as well as I say, the inequalities, but it's really to inform the priorities for the strategic action and coordination for our vision, and also supporting the single outcomes framework under the Active, Connected and Prosperous Board. Next slide, please. The JSNA isn't just one product, and it's not just about having a static document as well, and I really want to emphasise that really, but it's about a range of products to support that shared and consistent story of the health and wellbeing needs of our residents. So we have got a dedicated Bolton JSNA website, which I'll talk through in a minute at the end of this presentation, but it's also about some of the data and intelligence digests so that we have that overview. And I've just gone through the Public Health Annual Report, and we'll be publishing that on our JSNA website. It's also to ensure that we can support and inform decisions, such as Bolton's fund, to help direct the resources, as well as having summary text to support strategies and bids. We're producing infographics as we go through, and there's also slide sets that are on the JSNA website as well. So again, to have that much wider comprehension of our, again, going back to our local needs and assets within our community. Next slide, please. The pharmaceutical needs assessment, I have mentioned this a couple of times. So as I say, it is a statutory duty. It is separate and distinct to the JSNA, and all up-to-tier local authorities are to publish a pharmaceutical needs assessment. It's also used by NHS England to inform decision on commissioning pharmaceutical services. We do have a PNA, a pharmaceutical needs assessment, so our statutory duty is being met, and we have got the link there, and it's going to go onto our JSNA website very soon. As I said, originally the PNA was valid until the March 2021, but recently, due to COVID, the Department of Health and Social Care requirement to publish that renewed PNA was suspended until April 2022. But we will be starting work on it, or we've started work on it, sorry, in August 2021, because it's a good 6 to 9 month lead-in time for having a comprehensive pharmaceutical needs assessment that, as I say, has to be fully reviewed every 3 years, and obviously 4 given the delay due to COVID. Next slide, please. In relation to governance, as part of not just having the information and having the website, it's really important that we have the governance and that we feed into the Active, Connected and Prosperous Board. So we have underneath the Active, Connected and Prosperous Board, we have a JSNA Outcomes Leadership Group. This is to ensure the delivery of the JSNA is in line with our statutory guidance and provides assurance to the Health and Wellbeing Board, the ACP Board. It's also going to have the oversight of the Single Outcomes Framework, again, that's linked into the Bolton Vision and the ACP Board, to meet 2 to 4 times a year, and it's a joint chair between ourselves, local authority, so Councillor Susan Baines with the CCG. The officer there is Mel McGuinness. And again, the importance of having it as a joint chair is because it is that joint responsibility of a JSNA of the CCG and the local authority. Sitting underneath the leadership group will be an operational group that prepares all of the work, it monitors delivery, does the particular operational work, and is that real development work. What I'm really what is really good to see that what COVID-19 has enabled us to do is really bring that work together and bring the operational work together through COVID-19 with all of our partners as well, and also oversees the comms and dissemination of the JSNA products. And as you'll see there on this slide, that we will be establishing a P&A working group when we need to for the refresh of that pharmaceutical needs assessment. And then we have some task and finish groups as and when required for specific pieces of work that we will be doing. Next slide, please. Oh, it's over to me for the slides now. I'm going to try and take control now, if that's okay. And I want to just quickly give you a whistle-stop tour through the JSNA website. Oh, hold on. Let's turn my camera off then. Desktop, bear with me. There we go. Can you all see the JSNA website there?
Not yet. There we are. Yeah, we can. Yeah.
Okay, so I'm not going to go through all of this, but it is freely available. It is on the internet now, so boltonjsna.org.uk, our joint strategic needs assessment, sharing our knowledge about health and wellbeing needs of people in Bolton. I'm sure you've all been looking at this recently anyway, because it is the link to the coronavirus, so we have got a separate section within here for our coronavirus resources. I'm not going to go through that one, but Bolton in brief, what we've done here is a brief overview of the health of Bolton residents, and when you click on there you can see just a very brief summary of information there, and we also can link to the Public Health Outcomes Framework, which is the national framework, as well as Office for National Statistics if people want to get further information there. When we look about our people, key statistics for our population, it'll say here that what we've got a population of, what our ethnicity, religion and belief, deprivation, birth, deaths, population movement, as well as cause of death and life expectancy. So I click on deprivation. Councillor Peel, you mentioned deprivation in relation to the Public Health Annual Report. Just give an explanation here around what an IMD is, what it means, how it's calculated, and then goes into the Bolton picture here so that we can see where we currently stand. So if we look at our ranking, where IMD ranking 1 is the most deprived, we can see that Bolton here is 34. And we're just comparing ourselves. This is the national ranking, but we have put ourselves here across with other local authorities in Greater Manchester. And again, more information about the deprivation here, as well as the map. And it is an interactive map, so it does get updated regularly there when the data does get information. Again, birth, death, population movement. Again, we can just quickly, I'm not going to go into everything, but just causes of death here. So again, we can look at what people die from, or die of, should I say, here. And so we can look, and on the right hand side, you'll see that you can click different age groups, so you can then target down for more information. But at the moment, it is showing all ages and all males and females, but as I say, you can click onto this to make it much more interactive if you so wish to do so. So what we've tried to do for this JSNA is, sorry, my network seems to be very slow at the moment for some reason, but what we've tried to do is have the information so it becomes interactive where we can, static where it needs to be, and then also linking when it can do for more real-time data. We've also got information about our place as well as our health. So if we just quickly go into our health, so for example, mental health and wellbeing, again, you can click into there for more information. GP practices, so you can find out about our different GP practices, as well as ill health. And again, if we just click on here, it talks about what a definition of ill health is from the World Health Organization, as well as more links. So it is really developing over time, all of this, and again, you can link into some of the nationally published information, so you can then get our local authority health profile. So again, what we try to do is to make sure that nothing goes out of date on here, or as little as possible, should I say. And in our place, just finally, let's talk about air quality. It's got some information about the demographics and segmentation, lifestyle and behaviours, their work, school attainment, assets, as well as our built and natural environment. Now, when you go into some of these, they might not have comprehensive information yet, but we are working on this and we wanted to get it out as quickly as possible. But again, if we just look at lifestyle, we've got something about smoking here, physical activity, alcohol, healthy eating, healthy weights, and again, we can click on each of those. And also just to say there's a search button at each part of this. So, sorry, I'll clap that off. And I'm going to pause there and I'm going to stop sharing my screen and take any questions that people may have in relation to either the website or the wider JSNA as mentioned in the presentation. Thank you.
Thanks, Helen, and as I said before, it's just a fantastic document. Thanks to you and Lynn and the team for all you've done on that. It really is it's a credit, really is a credit to the to what's been produced. So, Councillor Howarth.
Oh, sorry. Thank you, Leader. Sorry about the delay there with my IT. Yeah, it's a question around the JSNA and how that creates the public health work. And I am persuaded that, as you have included in your report, that violence is a public health issue, yes, as well as a law and order issue. So obviously you've been looking at crime. Would you be allowed to, if you like, look at domestic violence then, in the sense that it's a persistent high volume crime in the Bolton borough, and what you would want to say or do, if you like, around the determinants of that issue, domestic violence. I've been persuaded, or informed is a better word, for a while, of course, that it relates to one of the 3 key determinants of child harm, domestic violence. You know, the other, so domestic violence is one of the key determinants of child harm. This is the last time I was informed on these matters, the others being substances, if I remember. I mean, it feels like there's still a fair bit to achieve on domestic violence, so hope that's okay, flagging that as one of the areas. Thank you.
Yes, and thank you for raising that, Councillor Howarth. What Public Health is doing is working really closely with the Community Safety Partnership. We're also working really closely with the Children's Partnership Board, because you're absolutely right. When we look at domestic abuse or we look at violence, we've got to look underneath and we've got to look at different components. So when we look at violence, we'll then look at the different types of violence, and obviously domestic abuse is within that. And then in addition to that, we go into, especially from a public health perspective, into the root causes. And going back to the Public Health Annual Report, which is one of the reasons why the adverse childhood experiences is so key to all of this, to understand what our prevalence is across Bolton. Again, it's been deferred because of COVID, because it is a door-to-door survey in relation to that, but it is, you know, the adverse childhood experiences, just having within it about parent caregiver who domestic abuse within the household, as well as substance misuse, including alcohol dependency and also prescribed medication dependency, as well as mental illness, suicidal tendencies, and a host of other direct and indirect types of abuse for children, towards children. So absolutely trying to take that life generation, that whole generation and whole society perspective. It's also, as I say, around people being able to talk about domestic abuse, being able to understand the impact it has, and also to think about where any signs and providing a safe environment for people to discuss. So absolutely, and this is where, again, coming back to both the Public Health Annual Report and the JSNA, this is the start of the conversations to be able to dig in underneath and deeper. But it also is around we're working with our partners, again, across the directorates within the council, but also our wider partners, including the voluntary sector, absolutely key, as well as the NHS and others. But as I say, one of the key aspects is in addition to the Active Connect and Prosperous boards, so the Health and Wellbeing Board, it's also the Community Safety Partnership that we have here in Bolton as well, and the phenomenal work that they're doing. And it's working across, so that, again, we keep aligning our vision, our strategy, but then we get into the detail underneath of what interventions we need to put in place. And as I say, going right to the root causes and through to childhood adversity. Thank you.
Councillor Peel.
Thanks, David. For some reason, my chat function is, I'm just getting error messages. I'm aware we've got a recovery group on Wednesday, recovery board. Can I ask if the latest COVID-19 data is going to be on that? Because if the answer is we do have, because we've not seen the agenda yet, if the answer is we're going to have a full data update on that, it will qualify my question. Thanks, Tony. So I'll just give you pre-warning of so I don't expect an answer now, because I suppose the matter of a couple of days will help you, and there's no point in us repeating the discussion. But the JSNA, of course, is being used by everybody at the moment to look at the COVID stats. And it's a pity, really, because it's such a good website and there's lots and lots of good stuff on there. But that's how everybody's logging into Bolton's JSNA to check the COVID stats, which is myself included, which is fine. My questions for Wednesday then is, I'm looking at the line, the cumulative confirmed cases of COVID amongst Bolton residents. It doesn't appear to have ever flatlined, in my opinion, of reading data. It looks like a steady and sustained increase until the current sharp rise. So I'd like your opinion on that. The last 3 days, 0 increases. Is that a time lag? That's my second question. And my third question is, I suppose it's open to interpretation, but the narrative from the council was that last week was that the infection rates were quite even across wards. You could read that another way and say that there was definitely concentrated infections in the wards of Breakneck and Tongue with the Hoff. Definitely outstrip any other wards. I'm looking at wards rather than the health authority boundaries. So as I say, Helen and David, rather than initiate a full discussion on this now, that's my questions for Wednesday, and we can discuss it in more detail then. Thank you.
Yeah, thanks, Nick, for that. So just for clarification, the first item on the recovery board on Wednesday will absolutely be a full update on where we are with the current position, the supporting data towards that, and there'll be an in-depth discussion on that, and there'll be other items on the agenda, but I'm sure that will be the main item and our response. So I don't think there's any further questions on the JSNA. Just a huge thank you for the work that's been done. So just for cabinet members, if you could just unmute, the recommendations is to receive the Director of Public Health's annual report on the health of the local population, Public Health Annual Report 2019-20, along with the JSNA. So can I just have you to unmute and just confirm that you note that, please?
Yeah, in favour, David.
In favour.
Well done, Helen.
Thank you. Excellent. Thank you very much. So that concludes the business of Cabinet today. Thank you very much for joining us, and to those that joined us throughout the meeting online, and see you all again soon. Thank you very much indeed. Bye-bye.